Chatham, Kent, Essex.
Thank you very much, Speaker. My question is to the acting Premier. Mr. Speaker, the London Police estimate that they handled over 2,000 mental health calls in 2014. These calls could be better dealt with by the medical community. Now, this problem has gotten progressively worse under the Liberal government. Police services have reported that the number of mental health calls have skyrocketed over the last decade. The average wait for funded counselling and treatment is measured in months, not days. And this forces people to call 911 instead. So, Speaker, to the acting Premier, why does Ontario force those experiencing mental health issues to call the police instead of providing medical help?
Thank you. Thank you, Premier.
To the Minister of Community Safety and Correctional Services.
Minister of Community Safety and Correctional Services.
Thank you very much, Speaker, and I appreciate the question from the member opposite. First of all, I want to commend our police services right across this province for the incredible job that they do day in and day out, dealing with very, very challenging circumstances. And the member's quite right, and there are a number of exemplary enforcement detachments that we can talk about, in particular the example in Hamilton and the work that is being done with the mental health experts who are participating with police in calls where there's a belief that an individual may have mental health issues. And so recently, through our Proceeds to Crime, we've also supported projects across the province for various police forces, municipal police forces, so that they can engage with mental health partners in their communities to bring them along on calls to address these types of issues. Thank you, Speaker.
Supplementary.
Thank you, Speaker. Well, Minister, I won't disagree with you on the fact that our police do exemplary work. The Liberal government status quo is inefficient use of public dollars and an unfair burden to place on emergency responders. Speaker, the London Police Service estimates that mental health calls account for roughly 15% of its budget, costing them more than $14 million. But worst of all is the human cost. The status quo is a tragic disservice to Ontarians suffering from mental health issues. Police have called this government time and time again to step up and to address the issue. But to date, the Liberal government has a failing grade. All talk, no action. So, Speaker, to the Minister, when will the government start to take mental health seriously instead of leaving frontline officers and emergency responders to deal with the fallout?
Thank you. Minister.
You know, Speaker, the characterization is completely unfair. You know, I was at the Ontario Police College a couple of weeks ago, meeting with folks at the Ontario Police College about the training that they're getting to address individuals with mental health. I had an opportunity to speak to a class, in fact, a new class of recruits, and they were in the middle of de-escalation training related to mental health. We know there's an Ombudsman report with 22 recommendations that our government has committed to implementing. Speaker, I'll have more to say on that at the end of the month. But our police forces across the province are being equipped and are being supported with mental health resources so that they can deal with the exact types of calls and issues that they are increasingly facing in our communities today. This is very, very important, Speaker, to policing across Ontario. I will have more to say about our strategy for Safer Ontario that we want to implement, which also has tremendous benefit for individuals with mental illness. Thank you, Speaker.